So different teachings that were passed down from generation to generation. They do have arranged marriages, which is normally when a man and woman whose families were, friends or knew each other from the village prior to, was set up and arranged for them to get married. Normally the husband's family or the husband will pay some type of sort of a dowry where he'll give like a goat or some type of sacrificial animal or a cow to the family of the bride in order to kind of pay a dowry towards them. Fathers are the head of the households, which is kind of still the same in Western traditions. Women are inferior to men, so just now women were allowed to get their driver's license, but they still have to have permission of the husband or permission of a man in order to get their driver's license. Women are so inferior to men that they're almost the equivalent of children. And again, it just states that they have to have the consent of the husband for a driver's license. Family values. I found it very, very interesting. It's still kind of like taking a step back from Western tradition, but in Swaziland, it's strictly a heterosexual society. Homosexuality is in total conflict with their traditions, and if you do come out the proverbial closet there, you're ostracized, and I mean ostracized in newspaper, ostracized in town. You're treated like a complete black sheep when it comes to being a homosexual. You're ridiculed by everyone. So therefore, homosexuality is something that, like in prior days of Western tradition, you kept it all in the closet. It was hush hush. Nobody said anything. Nowadays, in Western tradition, you can come out and speak freely about it. It still might not be the going thing, but it's at least somewhat respected. Here, you're just completely outcast and ridiculed. Next slide. Nutrition. The main food crop in Swaziland is maize, which is like a kind of corn. And the accessibility is based on what you can grow. So if your family is having a hard time growing your crops, then you're less likely to have an abundance and you won't really be able to eat, because what you grow is also what you sell. So it's also your income plus your nutrition. So they have set up food aids, which are resources for people who are having a hard time growing or getting access to food, and it's greater than 2,000 people at any time can be relying on the food aid. Next slide. Child rearing. We all recognize this commercial with children who are malnutrition and starved. A lot of the child rearing in Swaziland is children raising children. Once you're 3 years old and can somewhat communicate with other kids, the parents leave you with a 6-7-year-old, and that child takes care of you. So it basically has children taking care of children. The boys are taught at a very young age to take care of livestock, so the cattle, any type of buffalo or chicken or whatever the livestock is, the boys are taught to take care of that. And the girls, with children taking care of children, 7-year-olds taking care of 3-year-olds, are taught to be domesticated and to take care of the household chores. So it starts at a very, very young age. To me, it's almost like you're not even a child, because at 3 years old, you with a 7-year-old who's also trying to prepare meals for the family, get water from the family. So that's why we always see those commercials where a little child is carrying another child on her back and carrying water on her head. Next slide. Diseases common in Swaziland. We are all familiar with HIV being one of the top diseases in Africa, followed by lower respiratory infections just due to the poor hygiene and the poor taking care of themselves. Tuberculosis follows behind with diarrheal diseases, ischemic heart diseases, stroke, cancer, and diabetes. And I will go into these diseases a little bit further down in the presentation when we start to talk about nursing implications. Next slide. Burial rituals. I found this very, very interesting. In Swaziland, they do believe in a supreme being. If you die, that there's somebody greater than us that created the heavens and the earth. They do believe in afterlife, but not so much in the same sense as in Hindu or Buddhism. They do believe in reincarnation, but like I said, not the same as Buddhism and Hinduism, where Buddhists and Hindu believe that, you know, you can come back as a different person or a different thing, and it's just this continual cycle. And if you're not good, or your karma is bad in the previous life, you'll, you know, reap it in your reincarnation. But with the people in Swaziland, when you're reincarnated, you know, they believe that their ancestors come back as powerful animals, such as lions and eagles, or they can come back as children in the family. So they find it very, very important to figure out, you know, that this new child in our family, is this one of our ancestors, so that they'll be held in a higher regard. The other interesting part that I found, that if you die in your home, they remove you through a hole in the wall in the house. And after they make this hole in the wall and remove you, and 9 times out of 10 they remove you feet first, so that your spirit will have a harder time finding its way back to the home. And immediately when they remove you, the hole is closed up. And then as they remove you and are taking you to your grave site, they put thorns along the path so that you can't find your way back to that house, which I thought was really interesting, because if they hold people in such a high regard, why don't they want them to be able to come back to the home? So I just found that very interesting. And this is one of the traditional healers with, yes, a snake in his mouth, which he is performing a ritualistic ceremony at a funeral. And at the funerals, I also found it interesting that if you weren't married or if you were a child, you couldn't come to the funeral. And then the family that was there at the funeral stayed on one side of the grave, and everybody else stayed on the opposite side, which I could kind of see the similarities, because in normal Western tradition, we now have, at least in the African American community, the family at the funeral sits on the first rows, or the one side of the church, and all the visitors and everybody sit on the other side. And then at the grave site, the family sits first, and then everyone sits behind them. On the burial rituals, correct funeral rites must be observed, or the dead will come back to haunt you, which I kind of told you that's kind of why they put the people out through a hole in the house and do feet first. Normally there is some type of ritualistic animal that is sacrificed during that time. And they also take the skin of ritualistic animals or sacrifices, and they cover the coffin with it as a means of respect. And funerals are then those times where people of Swaziland have the opportunity to actually declare their faith or to practice their faith. High-risk health behaviors. As I said prior to a couple slides back, the increased prevalence of human immunodeficiency virus, or HIV. This is found rampant in Africa due to, one, sex trafficking is not monitored there by no means. It is nothing for even the prince of Swaziland to have had sex with a child aged 10, 11, 12, and to have had sex with multiple children throughout the actual society, and that be the norm for them. So with the increased prevalence of HIV, we're now gearing more learning and teaching to abstinence and condom utilization, but we still have those instances of rape and sex trafficking that are going on that we have at this point, no means of controlling. Also, alcohol consumption is putting the men and women there at a greater risk of esophageal cancer, of course, liver cancer, homicide, and now that they are moving toward driving more motor vehicle accidents. And just to touch back on the increased prevalence of HIV, we are seeing a great increase in intergenerational sex and polygamous marriages. We all know, from TV, polygamy, where one man will have multiple wives, or in Africa, multiple concubines. And then the intergenerational sex is nothing for a father to be a father and a grandfather to the same child because he's had sex with a daughter or another one of the other family members. Next slide. This is just a actual study that they did on promoting abstinence and condom use. It just shows like a genograph of how if we were to get X amount of child age students, so they are starting very young at 10 and between 10 and 14, and teaching them to utilize condoms, and we're starting this at an early age, then maybe we can cut back on that increased prevalence of HIV. Healthcare benefits and practices. Normally in Swaziland, they use traditional healers just because they don't have the funds to go regularly see a doctor or go to a hospital or go to a clinic, and it's still kind of taboo there. So they do still believe in traditional healers. And they also believe that these healers are the ones that cure some of those major diseases that we see as happening from different types of evolution of other diseases, whereas they see it as a sense of sorcery. So if you come down with TB, they figure you did something bad and somebody cast a spell on you, and that's how you got sick. So diseases such as cholera are treated best by Western medicine, but they see that as something that the traditional healer can cure. And they also feel like they can cure all children diseases and migraines. And whereas I can kind of understand that just from research, they're kind of hesitant to go to a doctor because they don't believe in them and they don't have that much knowledge of them. So they still consider that type of medicine themselves as taboo, whereas we consider what they're doing as taboo just because they don't know that much about it yet. So you trust things you don't know and are very leery of those that you don't. Next slide. So questions that we need to answer: how to provide culturally competent or culturally sensitive care. Whereas I consider what some of the things they do to be taboo, I still have to understand and respect them. So when I have this type of patient in my facility, I have to respect the fact that they may want a traditional healer to come into bedside to perform a type of ritual to cure them. I'm not saying bring in no snakes and no cows, but I still have to be cognizant and respect their wishes. It's all in line with that transcultural theory of nursing, where we have to be diverse and know about other cultures and in turn respect them. So how to communicate with them? First of all, is everything starts with respect. So communication, respect, knowing the different types of nonverbal cues, verbal cues, when to look people in the eye. As a female dealing with a male patient from Swaziland, I am considered inferior, so I would not speak directly to him and looking into his eyes. I would more or less probably get a male nurse to come in to intercede with him, whereas with the woman, I would be more on her level and she would be more opportune to talk to me. So it's just about knowing, I guess, my place in their society and respecting it. And what to include in health promotion and education. In Swaziland, we have to push for condom use and sexually transmitted diseases and the premarital sex and having babies and just trying, and overall abstinence in order to kind of cure or to alleviate or decrease the incidence